Neuro Bio Feedback and its use in relaxation and meditation.
I couldn't think of a better place to come and talk to you about meditation and relaxation than the place where I come to relax the most. Meditation and relaxation are treatments that are often used for disorders like anxiety, depression, and insomnia. The important part of utilizing relaxation and meditation as a technique for treatment options is to ensure that you perfect it as much as possible to help achieve the best outcomes. Neuro Bio Feedback, or neurofeedback, is a relatively new concept that has been utilized to help perfect relaxation and meditation techniques. It has been described as a method of therapy that heals or retrains the brain, and when combined with psychotherapy, it helps to create a more lasting change or recovery and minimizes the use of medication therapy. Neurobiofeedback is typically a 30-minute session. It's a non-invasive procedure, and in that 30-minute session, patients usually have a comfortable or quiet environment where sensors are attached to their head in a hat that has wires across it that's similar to when someone has an EEG because it monitors brainwaves. These sensors capture brainwave activity while the person is doing a certain activity. Sometimes they watch movies, sometimes TV shows, they may complete puzzles or games, or sometimes they listen to music. These brainwaves are monitored and the input is regulated. It's actually designed to analyze the brain waves and help the brain to make the best use it possibly can and optimize the natural resources of the brain. So during this session, the input from the brain activity reflects in the waves that come across the EEG. Depending on the program that's utilized during this session, whether it's a TV show, whether it's music or a video game, sometimes in the TV shows, the TV show may become blurry while the person's brain waves are out of sync. The colors may fade in and out, or the music that they're listening to may skip or fade. This reminds or triggers the brain to correct and optimize its functioning in order to have the reward, which would be then returning to the TV program or the music back to normal. Throughout the next portion of the video, I'll discuss further neurofeedback or neurobiofeedback. I'll talk about the concepts, the background of neurofeedback, the uses of it, and how it is utilized specifically for meditation and relaxation therapy.
What is neurofeedback or neurobiofeedback? Neurofeedback is a type of biofeedback in which the brain activity changes are measured in real-time therapy sessions and then presented to the participant in such a way that they can redirect their brain activity and change the way their brain actually functions to optimize its capacity. Neurofeedback makes information about brain activity accessible to our consciousness, which we normally don't think about on a regular basis. Participants are able to learn voluntary control over their own brain activity, and this has been shown to help change perceptions, behaviors, and emotions when it's utilized with patients, especially patients with mental health disorders. Neurofeedback can be used as a functional therapeutic tool where patients can learn to normalize dysfunctional patterns of brain activity that are associated with their disorders or diagnoses. And in this case, we discussed the use of meditation and relaxation techniques to help with the treatment of anxiety, insomnia, and depression. Neurofeedback is seen as a non-invasive and safe procedure that can be personalized to the individual needs of each patient, can be combined with conventional therapeutic approaches such as psychotherapy and medication management, and can help to focus on the fundamental human capacity or our ability to learn. Brain waves were initially discovered by a German psychiatrist named Hans Berger. In 1924, he used an Edelman string galvanometer to complete the first successful EEG, or biofeedback, of electrical brain activity. Despite his careful research and publications throughout all this time, it wasn't until 1934 when other researchers drew some attention to what brainwaves actually were. In the 1960s, there was two researchers by the names of Dr. Joe Kamaya and Dr. Barry Sturman who began using neurofeedback as a treatment option. At this time, Kamaya and Sturman were both researching different things and exploring the role that alpha wave activity played on consciousness and how brain activity was affected during sleep. Both were trying to discover the role that brain waves played in the aspects of behavior, and in doing this, they started realizing that neurofeedback was a treatment option to help change brain waves and brain activity. So how does neurobiofeedback actually work in the aspect of improving meditation techniques and relaxation techniques for use with anxiety disorders and other mental health conditions? I'm providing an example of an actual neurofeedback session on meditation and relaxation, and you can see it doesn't reflect based on your own breathing, but if someone was to utilize this, you can see how the pictures fade in and out as the person is not in sync with the brain waves and the heart rate and blood pressure variability that is conducive to what the program expects for relaxation. You can see that at the bottom of the screen, there's actually icons on the bottom that show you how the levels are supposed to be, and you can see as the picture fades in and out, just as an example of what it would be like in a neurofeedback session. When using neurobiofeedback or neurofeedback to help improve techniques for relaxation and meditation, you actually learn to control your own body by breathing and doing a number of different relaxation techniques according to the program that you utilize. This is usually a computer program, a television program. There's many of them on the market and different ones out there, but most of them, the way they work is they tell you how to deep breathe. They talk you through the session and they say to you, breathe along with the video. You may breathe in, hold for 3 seconds, breathe out. There's different ways that the programs work, but what it does is it measures your heart rate and your brain waves, and it sends that to the biofeedback device. And then that biofeedback device, which is part of the computer program, will then create the audiovisual display, which is the display that we were talking about, that in some cases and in some programs it will either change the color of the screen, make it go fade black to white, or change the colors, and sometimes makes the programs go blurry if you're not in sync with what the program expects you to be. So this feedback on blood pressure, heart rate, muscle tension, and brain waves provides you the reward system of seeing different pictures and seeing different things that your brain actually wants to see.
Direct your attention to your body and relax. Breathe slowly and deeply in and out. Breathe along with the breathing rhythm of your life. Relax your eyes and your head, your chest and belly.
This session may have been actually difficult for you to watch because normally our brain actually wants us to have things in focus and wants to see things a certain way. And the way neurofeedback works is it presents rewards to these patients through the feedback of their brain waves when they're in sync and effectively participating in the treatment or the program that they're working with. The sample meditation relaxation video offers rewards as the patients focus more on their breathing and as they reach that target heart rate that is set by the program and their blood pressure is within the normal limits. As you could see by that video, they were not in sync. And sometimes it takes multiple sessions to be able to bring your heart rate down and to control your breathing. Focus and concentration on perfecting this meditation technique by modeling the breathing results in the reward of clearly viewing the scenery, in this case, the fall leaves, the forest, and hearing those sounds that will help with meditation. Without focus and concentration to calm your heart rate and reach that target level, you don't receive the intended reward, which is typically what our brain wants us to see. The patient then has to work harder to focus and pay attention in order to receive those rewards. And in turn, this retrains the brain to know that once they stop focusing on their breathing and stop paying attention and doing what they need to do to keep their heart rate at the rate it needs to be and their blood pressure at a certain level, then they'll automatically do that for themselves as a meditation or relaxation technique in the future.